Good day and welcome to another episode of Fertility Talk with Olarunke Thaddeus. On this episode, we'll be talking about some real issue that centers around infertility, reason why you're not getting pregnant. So that is the discussion for today. Recently, I met a patient and she was coming for fertility evaluation for the first time in 5 years. I found it a bit disturbing because I usually would expect that once pregnancy is not achievable under 1 year, then you should have taken that step to visit your doctor. I asked her why she was just coming at that point, and she was like, she never thought she had issue, that her husband had not always been around, so she never really thought that there was issue. So she knew she wasn't having sex regularly, so that was why she never thought there was any medical issue. So she became worried when the husband spent 1 year with her and there was no pregnancy. Okay, so this brings me to the main topic proper. When you're trying to achieve pregnancy, it is very, very important that you have sex regularly. In fact, as a matter of fact, if you can be having that sex every day, if you can have it, that would work. Yes, I know some of our men would scream that, do I want to kill them? Yeah, but trust me, it would help. But if you cannot have it every day, then maybe 3 to 4 times in a week, yes, that would be cool. That would be cool. And if you have consistently been having sex 3 to 4 times at most in a week and there's no pregnancy, then, and you've done this for 1 year and you are under 35, please, you need to visit a specialist, okay, immediately for a fertility evaluation. That is very, very important, okay? If you notice, I said below 35. If you have had sex regularly for 1 year and you're below 35, yes, you can wait for 1 year. But man, if you married at age 35 and above and you've had sex consistently for 6 months and pregnancy is not happening, then yeah, don't wait for 1 year. 6 months. The reason why I'm saying this is because age is running, okay? Age is one greatest factor when it comes to having baby. The younger you are, the higher your chances. The older you are, the lower your chances. So that's why I gave that time frame, okay? So let's talk about some reasons why pregnancy might be difficult, okay, if you've been having sex and you're not getting pregnant. So let's talk about it. Number 1 on my list, could it be that you have problem with your ovary? Ovulation problem, yes. In my previous video, I've spoken about ovulation and how it can prevent you from getting pregnant. Yes, if you have problem with ovulation, then yes, we need to address that if you want to get pregnant. So it could just be you have ovulation problem, okay? So you need to watch that video to know, okay? Then could it just be that you have a fibroid issue? Yes, if you have a fibroid in your womb, then getting pregnant will be very, very difficult, especially when that fibroid is located on the lining of your uterus. It will be very, very difficult to achieve pregnancy. So that fibroid must just go, for pregnancy to take place. So another thing is, could it just be ovarian failure? Ovarian failure, yeah, could it be? I've met a lot of people that had ovarian failure even below age 40. So sometimes, although it has a lot to do with age, but yeah, I've come across pretty young ladies that had ovarian failure, pretty young. And if you're in this kind of situation, yes, the way out usually is to do IVF, okay? Could it just be that you have issues such as scar or adhesion? If you have scars on your uterus, on your ovaries, if you have scar tissues all around, then it is going to be very difficult to get pregnant. How do you come about having adhesion? These are caused by previous surgeries, by previous D&C, maybe you had a past cesarean section done before, all this could would make you to have scars, okay, on your pelvic area. Or could it just be that you have taken some drugs that have messed up with your ovaries? Could it just be? So this is why I usually would advise that before you take any drugs, please, you need to find out from your doctor if the content is okay, because some drugs can actually mess up with your ovaries, okay? So you need to be careful before you pick up that drugs from the counter. So could it just be you have pelvic inflammatory diseases, PID? PID is one of the female genital upper tract diseases. It can affect the ovaries, the womb, the fallopian tubes, so it's usually caused by sexually transmitted infection. So you need to watch out for that. Once you notice any discomfort around your vagina, please, you need to act fast before it gets out of hand. Once you have your fallopian tube blocks, that is really a major issue, and a way around that is actually to seek for alternative fertility method, because getting pregnant naturally would almost become impossible, okay? So you need to take care of yourself as a woman so that you don't have PID. Or could it just be you have endometriosis? Endometriosis is when the tissue, the lining inside your uterus, starts growing in other places. You're seeing it outside your ovaries, your fallopian tube area, they're all there. Okay, could it just be that is the issue? Okay, so or could it just be you have adenomyosis? Okay, adenomyosis is when you have tissues built into your uterine cavity. When you have all this, then getting pregnant will be difficult. Okay, or most importantly, and I'm saying most importantly, could it be male infertility? Male infertility is a very huge topic which I will discuss in other video, okay? So when you come in for an evaluation, what we are trying to do is to touch all these areas to try to pin the possible reasons why you're not getting pregnant, okay? So this is why you cannot afford to pick up a drug and say this drug can make me get pregnant when you don't even know why you're not getting pregnant in the first place. Thanks for watching today's episode of Fertility Talk with Olarunke Thaddeus. If you have any medical issues, kindly comment below and I will gladly treat it on my next video. Also, don't forget to subscribe to our YouTube channel and follow us on our Instagram page at Meet Surrogate Mothers. You can also call the number showing on your screen for consultation with us. Okay, thank you and see you next time.